Hello, hello. Thank you. Thank you for joining me here. We're in the shed today. I call it my solar shed because the only light I have is a little solar light. And I also have another light. I'm going totally high tech here. I know I went out on a limb. I spent way too much money and got a little tripod with a light on it, and I think it was just under $5. I know that's a big investment. You're saying, why did you go out and spend that kind of money to do these silly vlogs and sometimes deliver some depressing news about the COVID report? But I got this light here, and see that? Hello? Can you see me now? Can you see me now? Oh, is there copyright on that? Can I do that? Actually do that? Having my coffee. We're going to have the COVID report here. Good news, I think. Some would say not so much if they're conspiracy theorists when it comes to the vaccine. And I don't care whatever your deal is. That's, more power to you, whatever blows your skirt up. Now, that being said, and a drink of coffee. Oh, look at this light. I don't know. You think this is going to work? Hey, look at. Maybe I don't put. So I think what I need to do, I need to turn it up all the way. I need to turn it up all the way. So I have to talk loud because the light's real bright. Oh, why did I do that? Now I'm just going to have a dot in front of my eyes. And I'm going to try to read this, and I'm going to have a dot in front of my eyes. A little rainy, a little dreary out today, but a good temperature, 50 degrees today, I think. And that's, hey, yesterday was 63. And, listen, this is 10th of December, 11th of December, something like that, 11th of December. So, hey, I'll take it, Let's get on with this. Okay. Boy, now I got this dot in front of my eyes, and the lighting's really poor on this, so, and that smoke going, that steam off my coffee going by right there. That's how good this thing for $1. How good it keeps it going. County receives COVID-19 vaccine soon. That's right. County's going to get its vaccine very soon. Says here, this county is one of 50 counties in Illinois to receive the vaccine. Vaccines will be rolled out in phases. In phase 1A, vaccine is targeted to the critical populations of frontline healthcare professionals and long-term care facility staff and residents. Okay. First allotment of the vaccine will focus on vaccinating the frontline hospital workers. Okay. And vaccinations for long-term care facility workers and residents will be provided by CVS and Walgreens Pharmacy through a federal contract. The administrator of the health department will be receiving a call today, which would have been the day before yesterday, actually. So they should have received the call by now. Okay, I'm not trying to beat the news out with the news. Okay. And then they'll have more details, but the details are changing at all the time, it says here. And it says the health department is working with the community hospital and healthcare personnel to prioritize who will receive the vaccine allotted during the first shipment. Other priority groups include in phase 1A of the vaccination plan include frontline healthcare workers who are caring for COVID-19 patients, pharmacists, plasma and blood donation workers, public health nurses, and other public health and emergency preparedness workers, dentists and hygienists, and funeral home workers. Okay. Information is forthcoming on those who will be in the phase 1B of the vaccination plan. Okay. Maybe this is a good thing, but listen, there's nothing in here about they didn't have a count on any of the new cases or anything like that. So I don't know what that is, but it is sounding a little more positive. People that need it urgently, and just, I'll get the vaccine myself. I don't mind. I get a flu shot every few years anyhow. And last 3 or 4 years, I think I've gotten one every year. I mean, my age, they say, oh, change your genetics, or, do something like, I don't plan on having any children, so, and probably no one in those old folks' homes do either. They say there is some allergic reactions if you're someone that is highly allergic to many different things. Maybe you might want to skip out on it or consult your physician. Either way, ladies and gentlemen, thank you very much for your time. This is Dillinger 101 coming at you with the COVID report from the Heartland. Thank you very much. You found this informative, entertaining at all. Hit the like button. You might even want to subscribe in case another one comes up, just pops up out of nowhere. You'll be one of the first people to know. Okay? So, with that being said, here's to the late morning coffee. Big old cup of it. Big old cup of it. Remember, smile at somebody today, and eventually they may smile back. If they don't, just think of all the smiles you've given away. Thank you for your time.